Welcome to End of Life Care Training, created by EDS. You will need a notepad and pen, concentration, and somewhere you can listen well. What is end of life care? End of life care is the care that we provide to an individual who is approaching the end of their life. The care we give enables them to live as best they can during this last period of their life. It enables them to die with dignity. It provides support physically, emotionally and spiritually. And end-of-life care can be a time period of only a few hours, or it could be a handful of months. When we're providing end-of-life care, it is also to support the family and friends of the individual. It might be the end of this one person's life, but at that time, it is a huge milestone in the lives of those close to them. When we're providing end-of-life care at EDS, we keep it incredibly simple. What is really important is the client's dignity, their comfort, and that their wishes are respected and upheld. So what do we mean by dignity? Dignity to me means feeling clean and fresh, specifically around skin, mouth, clothes and bedding. Within dignity, it's vital to remember we need to maintain privacy. That can be tricky in the time of end-of-life care. Lots of family members are often present, neighbours, friends, people they haven't seen for years, and often family members are very reluctant to leave the side of their relative, understandably. But when providing personal care, we still need to uphold that client's dignity. It is okay to ask people to leave the room while you provide personal care. Just explain why you're doing it. Be gentle but direct. And also remember, it is okay to do less than you normally might. It might be appropriate to only change a pad and not change the nightdress that somebody's wearing. It may be that you don't even change the pad because it's clean and it's dry. You provide mouth care to the mouth. Remembering that a reduction of medication may be a way of upholding dignity. If the client is struggling to swallow, flag it to the office and we can request this medication reviewed by the GP as a matter of urgency. We want to make sure everybody feels dignified and comfortable. Coming to comfortable, ensuring that somebody feels comfy is a challenge, and it can be a challenge when they can no longer verbally communicate with you. But always remember to treat each person as you would wish to be treated yourself. If somebody looks comfortable, and they look like they're in a relaxed seated or lay down position, then they normally are. If they're hunched over and look uncomfy, then they probably are. Ensuring the personal care, as we said, is minimised. To promote comfort, we need to concentrate on factors such as incontinence and ensuring the mouth is as clean and as moist as possible. It can't go without saying that to be comfortable, we have to be pain-free. It is deeply important that the individual remains pain-free. Any complaints of pain must be reported to the office so we can involve the relevant healthcare professionals. If a client is no longer able to verbalise with you, you can see pain cues if you look at the individual, unrolling them, for example, wincing of the face, tensing of the neck, the hands, clenching of the fists. Anything that you notice is really worth mentioning. We all have a shared goal in ensuring this time of this person's life is as comfortable and dignified as possible. When we talk about respecting wishes, it is obviously so important that any specific wishes held by the client are upheld and promoted wherever this is possible. Some clients may choose to have their dog move into their bedroom and even their bed when previously the dog lived outside. That's fine. If that's their request, it's fine. As long as we can work around it and it's safe and it doesn't compromise quality of care, then it's absolutely fine with us at EDS. Spiritual and cultural needs must be respected. Belief can be a huge part of what sustains a person, and this can transform an individual and their family's experience of life and when approaching death. We need to value the uniqueness of every individual. It's important that all cultural needs are enabled. And how we do that at EDS is we conduct a specific palliative care assessment. We call this our quality pathway, and it was designed by EDS. It's a very important document as it's tailored to assess, describe and promote individual needs and wishes, specifically surrounding end-of-life care. Remember here the meaning of mental capacity and best interest. What may appear as unwise decisions may be a firm and clear decision that an individual has made and wishes to stick to. For example, a recovered alcoholic may wish to have a nightcap for their last days. Seems unusual, seems out of character. It may be a very straightforward wish. Anything that somebody presents to you that sticks out, just discuss that with the office. We're always here to help and advise. When we're looking at providing care at end of life, the individual should always have health documentation relevant to their care. By this I mean a respect form or a DNA CPR, which basically means do not attempt CPR. If somebody has prescribed end of life care, we'd expect this document to be present. If you are providing end of life care, detailed by EDS that that's what that care is, and there's been no information regarding a respect form or a DNA CPR, please flag that up to one of the management at your earliest convenience, because there should be. Community nurses will be involved at this time, GPs will be involved, other community therapies may be involved to ensure this process is as smooth, comfortable and dignified as possible. Your duty of care as a carer remains really simple: to provide safe, dignified and kind care to all individuals receiving care at this time of their life. Documentation is, as always, heavily important. Supporting documentation will be required when providing palliative care. This is where your paper pressure relief charts and your paper food and fluid charts come into play. As mentioned, family and friends are absolutely key at this time of this individual's life. We must consider the individual's family as their own entity. As this is such a milestone for the family, we need to take additional consideration. We need to make allowances and increase tolerances where in other circumstances we possibly wouldn't. It is important to sympathise with family members and friends, but it is valuable not to empathise. These precious moments are that family members to remember about their relative. It is tempting to share our own experiences with somebody who is suffering, but that draws the quality to the moment that you had, and it takes it away from this moment that this family member is experiencing. So although it's tempting, refrain from doing that. Sympathise in this instance, don't empathise. Recognise the need to challenge care that may have a negative impact on the individual's dignity. Going back to, if there's lots of family members around the bedside and it's obvious that you need to change somebody's night clothes or continence aids, it is advisable, sensible and fair to request the family to step aside. If the family refuse to do that or decline, then you can of course encourage the family to be involved in that with you. That's absolutely fine. If you get persistent resistance, that's what the office and the on-call is there for. Please ring and we will try and advise you as best we can in that moment. We appreciate that providing palliative care can be really challenging, and at EDS we want you to be aware that you can access support too for yourself. If you feel uncomfortable, say, we're an open and approachable company and we'd always do our utmost to support you. Try. I would always encourage everyone to try providing palliative care. It can be such a privilege. It never becomes easy, but it often feels a privilege. All palliative care calls should be provided by 2 carers, not 1, to ensure maximum support for carers providing the direct care. We provide an in-house counselling session which is available to everybody, so if ever you need to access that, during or after providing palliative care, it's there for you whenever you need it. So as a recap, end of life care is really, really basic and it's really, really simple. It's all about the wishes and specific needs of that individual at that call on that day. Where possible, as long as it is deemed safe, whatever that client wants simply goes. All family will need caring for too, and consider yourself. Extend yourself the same care that you're giving to these relatives and this client. Give yourself as much patience. It really is a fantastic part of care provision, and it gives so much support and stability to the client and to the family, and they'll remember you forever.